everyone, welcome to our Impact 2020 webinar. It's great to have you here. This is the third webinar in our second Impact 2020 series, and today in partnership with Sacred Heart Mission. And it's the first day of Homelessness Week 2020. I'd like to begin by acknowledging the traditional owners of the land on which I work and live, and I pay my respects to elders past, present and emerging. Today we're starting things a little bit differently. We're going to be playing a video first from the Honourable Richard Wynne, who's the Minister for Housing, Planning and Multicultural Affairs in Victoria. Nick's just getting the video ready. After the video plays, we'll be hearing from our presenters, who you'll see if you have the gallery view open today. And first of all, we're going to start with Kathy Humphrey, who is the CEO of Sacred Heart Mission. We'll then continue on to Professor Paul Flateau, who is the Director of CSI UWA, and then we'll continue on to Associate Professor Monica Thilking, hope I'm saying that right. And then we're going to go on to Fred, who is a J2SI former client. So without further ado, hopefully we've got the video ready to go, and you can watch this first and then you'll hear from Kathy. Thank you, everyone.
Thank you for inviting me today to be part of this webinar, and I'm obviously sorry that I can't be there in person. I'd like to start my comments by acknowledging, of course, the traditional owners of the land on which we're meeting today, on the lands of the Kulin Nations in Victoria, and to pay my respects to elders past and present, and any elders who may be on with us today. It's fitting, of course, that Sacred Heart Mission are launching this evaluation report during Homeless Week, because the report confirms once again what we know, and that is to end homelessness for people sleeping rough, we must ensure that we provide in the first instance safe, affordable and secure housing. So through rigorous evaluation in phases 1 and 2, Sacred Heart Mission have been building the evidence base that shows that affordable housing and, of course, the wraparound supports can in fact have a transformative role in changing people's lives. And once again, the evaluation has demonstrated that it's far more cost effective to government to house people with the right supports rather than allow them to remain homeless. The mix of housing and support can reduce the use of acute services, and of course, ultimately, the cost to government and the community of both experiencing homelessness and the effect that has on all of the services such as our hospitals, the police, ambulances, and of course, ultimately for some people, the criminal justice system as well. And it's this cost effectiveness that's being tested through Phase 3 of Journey to Social Inclusion through the first of the Victorian Government's social impact bonds. This program, I have to say, has been put through the ringer of Treasury, and I have no doubt that this phase will show that the first two phases of this program have and that social and economic benefits of social inclusion for people experiencing homelessness far outweigh the costs of the program. This is really groundbreaking work. We know that in this conversation doesn't need to occur in places like the United States. They get it, and they've understood that for years. And that's why the work that has gone in and the rigour that Sacred Heart Mission have undertaken in this research really has been quite groundbreaking. I do recall, of course, that I funded the first round of this social inclusion research project back now nearly 10 years ago when I was Housing Minister, and I'm delighted, can I say, to be back again in the saddle, really hopefully making a difference, but also really continuing to support the crucial work that all of our homeless organisations make in every day, and in the most difficult of environments at the moment to support our most vulnerable residents. So I'm really, really pleased with our recent announcement of the $150 million Homeless to Home package and taking these lessons of providing housing first support, which is absolutely fundamental to breaking the cycle of homelessness. And as you've seen from the announcement earlier this week, the 150 million goes to really three crucial things. The first, of course, is supporting people currently, the 2,100 roughly people who are living in our hotels and motels across the CBD, metropolitan Melbourne and regional Victoria as well, to sustain their tenancies right through till April of next year, at least until April of next year. And then, of course, the head leasing of 1,100 properties, which will provide for 2 years a pathway for people to consolidate their situation, to ensure that we wrap around them the supports to maintain their tenancy going forward, and then looking for pathways out into potentially social housing, public housing, the private rental market. This is a really important package and one that I know has been very strongly supported and welcomed by so many of our homeless service providers. Can I say to Sacred Heart Mission and everybody else who's on this webinar today, these are challenging times. There's no question about that. And you can be assured of my continued support to all of you who are doing such a splendid job in such a difficult environment that we have with COVID. Homeless Weeks, stay safe. Thank you very much for your time today.
Good afternoon, everyone. It was great to hear Minister Wynne and his encouraging words, not only of our report, but also of, the trickiness that we're facing in Victoria at the moment. The Victorian Government support into homelessness is much warranted, and we really acknowledge the great work of Victorian Government and particularly the Department of Human Services, who are working extraordinarily hard during this time. So thank you, Minister Wynne, for your words. I'd like to also begin by acknowledging the traditional owners on the land on which we meet today across various lands across Australia. And I'd also like to pay my respects to elders past, present and future. Now, Sacred Heart Mission has been developing, piloting, modifying, evaluating and scaling J2SI for well over a decade now. Today, during Homelessness Week, which aims to unpack the theme, Everybody Needs a Home, you will hear specifically about Phase Two, which has delivered exceptional results for people experiencing a lifetime of disadvantage and chronic homelessness. Now, J2SI takes a housing first approach, providing people with housing, but also with 3 years of intensive support and case management to improve all areas of their lives. Now, this includes support, of course, to get and stay in housing, but also to improve their mental health and wellbeing, resolve drug and alcohol issues, build skills, increase connection with community, and contribute to society through economic and social inclusion activity. Now, J2SI is a trauma-informed, strengths-based program, which means we place people's needs at the centre of service delivery. We build trust and develop a relationship with participants in order to take them on that journey towards inclusion together. Simply put, J2SI works to end homelessness rather than simply manage it. It works on the premise that when people are able to stay in their housing and manage their complex health and social needs, people's reliance on the service system is reduced. We ran a successful pilot from 2009 to 2012 with 40 people from the inner south of Melbourne. It was the Australian first randomised controlled trial study, which set out to capture and prove what solves chronic homelessness. Now, Phase Two has extended the program to 60 people in multiple locations across Melbourne, and it ran from 2016 to 2019. When we started with Phase Two participants in 2016, 93% had experienced chronic homelessness and were homeless at referral. And another 7% reported they were in housing, but were at imminent risk of becoming homeless and also had histories of chronic homelessness. Now, J2SI Phase Two was highly successful in supporting people to exit homelessness through a rapid housing approach. Without spoiling the results that Paul and Monica will speak to, I will say generally that people in the program saw improved mental health, increased employment, reduced substance use. There was also a large reduction in the use of public health services such as hospitals, and drug and alcohol facilities. And this creates significant cost savings to government, which Paul will talk about. In the absence of J2SI, the research has shown that people use more expensive health and emergency services and have high rates of incarceration and are more likely to be and remain housed. Now, before I hand over to Paul, I want to take a moment to share with you our vision for J2SI for the future. Our vision is to see J2SI program across Australia with increased reach and even greater impact. This vision will see J2SI expanded through licensing agreements with partnering agencies across multiple service sites in Australia. Licensing J2SI will ensure the retention of the program's fidelity, create mechanisms for future research and continuous improvement. And this allows economies of scale to develop. A J2SI Evaluation and Learning Centre has been established to manage the partnership, licensing, evaluation and continuous improvement of the model. By creating a community of practice that replicates the critical elements of J2SI and brings together partnerships focused on ending chronic homelessness, we know we can drive impact and scale a proven evidence-based model. Now, we've commenced this work already through the implementation of J2SI Phase Three, as mentioned by the Minister. Now, this is currently underway and it incorporates the learnings from Phase Two. Phase Three is funded by a social impact investment with the Victorian Government to support 180 people across Melbourne. The vision for J2SI would not be possible without all the work put into J2SI, which commenced back in 2006, when we asked that important question of what was the impact we were having on the community. Our approach to continuous improvement of the service model will ensure that the learnings are used to improve the program into the future. I encourage you to take the time to read the reports, which will be sent to you by CSI tomorrow. And if you have any questions about our future vision, please get in contact with Sacred Heart Mission. Our research partners along this journey have been critical to gathering that evidence of impact. And on that note, I'd like to thank and hand over to Professor Paul Flatow from the University of Western Australia Centre for Social Impact, who will explain the research, its methodology and measures, and the positive change that has been realised as a result of the J2SI program. And with that said, I'd like to now officially launch the release of the final year's report and invite Paul to speak.
Thanks, Kathy. And I'm in Perth at the moment, so I'm on Whadjuk Noongar land and pay my respects to the elders of this land and to the elders of all the lands that we're meeting on today. It's very exciting for us, both here at CSI UWA and at Swinburne with Monica and her team as well, to launch these two reports, which, as Kathy said, will be available on the Sacred Heart Mission website and the CSI website, and no doubt many others as well tomorrow. So let's just begin by looking at the J2SI Phase Two research program. It's quite an amazing, as Kathy said, this was the first area of a randomized controlled trial approach in Australia around homelessness, and one of the very few in terms of the social area. This was very rich research in the sense that we covered off on both a quantitative side and a qualitative side, and Monica will be looking at that. It was an incredible effort over a number of years, and we thank all the participants in the study. Thank you so much for all that you've done. And also the J2SI team. I can see Anna there and Karen and others, and our research group, Zoe and Amy and others. Catherine is there too. So thanks everyone for all the work that you've done. So our J2SI Phase Two research, as you can see, covered off on survey data, covered off on what's called linked administrative data, where we connect into health data and the like. And it had a really significant qualitative component, which Monica is going to refer to. And the objectives are really to understand the impact for those experiencing chronic homelessness in Melbourne, what's the impact of this program? And in terms of the approach, some were randomized to the program and others were receiving support. So no one didn't receive support. And we acknowledge that in Melbourne, there were a number of programs that were implemented by the government in the mental health area, the drug and alcohol area, and in the homelessness area that provided additional support. So what was, if you like, the comparison group outcome is really a reflection of that as well. So it's not just the J2SI program. So if we look at those who were eligible participants at baseline, age 25 to 50, and experienced long-term chronic homelessness. Some of them were in fact in housing, but they were very much at risk of homelessness and had been homeless over time. So the profile in terms of survey participants, we've got one thing you'll have to be careful of when you're looking at these slides, and sorry to bother you with all of this, but we have a survey that was conducted over time amongst participants. And so you have the number of people who did the survey at the beginning and then did the survey at the end. And of course, there was change over time. Some people withdrew from doing the survey, for example. Very tragically, a group died during the study. And this points to the fact that homelessness has really high mortality outcomes. And this is one of the things that we do want to change over time. So there's a mix in terms of men and women, with men being the dominant group. Now I want to turn to the housing results, because the key in terms of the program was that housing was the #1 desired outcome. And whilst there wasn't guaranteed housing in this program, one has to remember it was the J2SI team and the systems approach that they adopted that created the housing links. And I think this is really important to say. But housing was the first stop. And what we saw in those housing results, if we're looking at that slide with the matched sample being those who did the baseline survey and did the final survey, was a really significant number moving into housing, permanent housing from homelessness. And it was close to 3 times that in the comparison group. So if we move to the next slide, where we actually examine change over time in what we call the fully matched sample, and we'll give you a test of all these samples at the end. In the fully matched sample, that transition into permanent housing was very rapid. So by 6 months, we had a significant number of people who transitioned into permanent housing through the J2SI program. We also had linked administrative data. So in the next slide, we can see that there was, in fact, a transition into public housing, or the previous slide had that transition into the public housing using that linked data. So we actually went to the public housing authorities and, well, not us directly, I might say, via the data linkage unit. And the work that was done by our team and the Victorian Data Linkage Unit was really incredible. So we could actually check those who had transitioned into public housing, and the work of Zoe and Amy was very important there, and the Victorian Data Linkage Unit. So thank you very much. But in this slide, you can see how using the Sacred Heart Mission's own data with just the J2SI group, how you had at the beginning this significant number who were experiencing primary homelessness in the main, moving rapidly into public housing and community housing and a little bit of private rental housing. And you can see that transition over time in their own data. Now, moving on to the next slide, one thing that was really critical in terms of the housing outcomes was the fact that permanent housing, as you saw earlier, was achieved very early in the piece by a significant number in the program, and then they maintained that permanent housing over time. So Sacred Heart Mission, through its team, were able, and it requires significant support, as we've shown in a lot of studies, significant support to maintain that housing over time. What was the consequence of that housing? Well, there are many consequences that you can read in the report, but one of the things was housing safety that you'll see in the next slide. So we had a significant increase in housing safety over time, feeling safe in their accommodation. And the important thing about this is that permanent housing is not just about access to permanent housing, it is that that housing becomes a home. Now let's turn to health outcomes. The health outcomes, in terms of physical health outcomes, were fairly stable over time. But we have to remember one important thing, and that is that on entry, if you read our reports, including the one that's released, chronic long-term health conditions is a significant part of this group. You can't actually solve those long-term health conditions. They are there chronically over time. But what you can do is provide a home that provides stability, that reduces other health issues and problems over time. So if we have a look at healthcare costs in the next slide, you can see that transition into permanent housing decreased healthcare costs. And this is our survey data. And we're doing quite a lot of work on linked administrative data, and some of those results are also there in the report. But a lot of this work will come out over time, but you've got a reduction in mean healthcare costs. And of course, the report and all of our work makes a very important point, which is you have to look at the distribution of healthcare costs and not just the mean. But that takes a bit of work, and so we don't have too much time for that. Whereas for the comparison group, I think without that stability, healthcare costs did rise. So let's now look at some other results from the study. This is the quantitative side to the study. And you can see there in terms of labour market activity, employment itself rose marginally, but what was interesting for the Journey to Social Inclusion group was that labour force participation did rise quite strongly, meaning that not only did you have some employment, but we also saw people move into looking for work, which is very important. Some of the key outcomes that we saw were in mental health and drug and alcohol areas. So if we move on to the mental health side of things in the next slide, there was significant change in terms of the Journey to Social Inclusion group over time. There were lots of different ways we got at this. So we're just focusing on one thing here today, which was results from what's called the DAS-21, Depression, Anxiety and Stress Scale. And we saw a decrease in depression over time. And this was in the fully matched sample where we were checking participants each point in time. We saw a decrease in anxiety, and we saw a decrease in stress. So I think there's a big link between providing that home and permanent housing with support and decrease in these kinds of impacts. Alcohol and drug use in the next slide, really interesting because in some of our other studies, we haven't actually found much change there in terms of alcohol and drug use and impact. Whereas here we saw a reduction in the mean number of substances used. And in terms of the next slide, where we can see that high risk use also decreased over time. So we saw a number of impacts, and read our report for many other impacts of the program. Now, I'm going to end just talking about the economic analysis. And as you can see in the slide, although it takes a little bit of time to get used to this slide, doesn't it? That there was significant savings for the J2SI group over time in the health area. So this is savings per person over the 3-year period. And what you'll see there is that the savings were 37,000 per person in terms of health in the J2SI group. There were no savings in the justice area. And if you compare that with the cost of the program, there was a return on that cost. In the comparison group, unfortunately, we saw an increase in health costs. We saw a greater increase in justice costs and a total overall cost in terms of government in those two areas, compared with a very conservative cost in terms of provision of support, I might say. So we didn't factor in any of the other Victorian Government support measures, just the base level of support. In terms of that comparison group, there was a net cost to government. So when you look at the two together, net, there was a $98,000 return in terms of that group. The J2SI group, 98,628. Don't worry about the 628 part, but around about 100,000 relative to the net cost, the differential cost. So the differential savings versus differential cost of 53,594 gave a return benefit cost ratio. And you can see the results in the next slide as well, which we'll just briefly refer to, which provide the same outcomes. So basically, in the end, the quantitative results show a significant set of benefits to J2SI clients over time. But Monica will be referring later to the qualitative outcomes where you hear those stories. So thanks very much.
Thanks, Paul, for that great summary and for the rigour in which you've evaluated J2SI. It's outstanding and will certainly ensure it stands the test of time and puts Australia on the map for developing evidence-based solutions that end chronic homelessness. Now, alongside Paul's report sits a qualitative study of the experiences and perspectives of the J2SI study participants. The report put together by Associate Professor Monica Thelking, the Chair of the Department of Psychological Sciences at Swinburne University, unpacks interviews over time, over the 3 years, with both J2SI participants from Phase 2 as well as people from the comparison group. I will now hand over to Monica to speak to her report.
Thanks very much, Kathy. And yes, my surname is a tricky one to say. I would like to start by acknowledging the traditional owners of the land on which we now meet as well. I pay my respects to elders past and present and emerging. I also pay my respect to all Aboriginal and Torres Strait Islander people of Australia and hope that the path towards reconciliation continues to be shared and embraced. I would also like to acknowledge all the people that have made this research possible, and I particularly thank the research participants who gave their time and shared their experiences with us so that we can learn about what is needed to end chronic homelessness. As we heard from Paul, the J2SI study participants took part in a large number of quantitative surveys. However, it was important to also include participants' voice in the evaluation via in-depth qualitative interviews. The qualitative study had two overarching aims, which you can see before you there: to hear from people who had a history of chronic homelessness about their experiences of the service system, especially in relation to getting the support they need to exit homelessness. and to provide an opportunity for those who are part of the J2SI Phase Two intervention at Sacred Heart Mission to provide feedback about their experience of this program. And we'll have Fred with us later to share more insights into his experience of the program as well, which is great. So it also meant hearing from J2SI participants about what the program meant for them. And you can see here that this participant's definition of J2SI very closely resembles the aims of the program. And for the purpose of the qualitative study, 10 J2SI and 10 comparison group participants were randomly selected, and data for 19 participants were included in the final report. Interviews occurred once a year over 3 years, and in total, 46 interviews were completed, with 63% completing all 3 waves of interviews. A team of experienced qualitative researchers met on a weekly basis over the past 3 years to analyse the data using open coding, thematic analysis and grounded theory methodologies. And once we'd completed our data analysis, we turned to participants to check that we had gotten it right. And this revealed that our analysis of the interview data reflected participants' experiences. And we hear often through the media and other channels that there is a lack of early intervention to prevent the flow of people into homelessness, and national shortage of affordable housing stock for permanent housing, and limitations in the duration and intensity of current support offerings once people have been housed. So our first goal was to hear from participants about their experiences of the service system, especially in relation to getting the support they needed to exit homelessness. Participants shared many stories about the barriers that they faced in relation to obtaining stable and adequate accommodation and getting their lives back on track. An overriding theme of chronic instability permeated their stories. Paul has mentioned the degree of personal challenges faced by the participants in the study, including mental health problems, health difficulties, and substance use issues. So 4 main themes were apparent in relation to participants' experiences of the service system, especially in relation to not getting the support they need to exit homelessness. And the first theme was related to poverty and unaffordable housing, prolonging their housing instability. For example, one participant spoke about not having enough money to pay for their medication for a chronic health issue. Others spoke about not being able to afford private rental options. And the second theme related to substandard housing options, intensifying their current issues. For example, a couple of participants spoke about being offered public housing that did not have enough bedrooms to allow their children to live with them as well. And the third theme was the experience of siloed and fragmented services that contributed to their experiences of chronic homelessness. And this related to many stories about a lack of service integration, including anecdotes about caseworkers and other frontline workers being overwhelmed by the demands of their role, which meant that vital opportunities that may have steered a participant out of homelessness were missed. Participants described feeling as if they were playing the waiting game. And the final theme in relation to participants' experiences of the service system, especially in relation to getting the support they needed to exit homelessness, was being excluded from the service system due to strict service or program eligibility requirements. Not quite fitting program eligibility, such as having issues that were either too severe or not severe enough, was a common feature of participants' experiences. And this was sometimes spoken about in relation to finding crisis accommodation. Collectively, these stories highlight the need for an integrated approach to service provision for individuals that puts the needs of the client at the centre. And the role of homeless services providers and the service system more generally should be to provide a streamlined, integrated, client-centred and quality service that anchors individuals in safe, secure and appropriate housing. And unfortunately, the experiences of participants revealed that this was not always the case. Now you can see in front of you a whole lot of needs. And here I want to reflect on what it means to have a home. So there's been an enormous amount of advocacy, particularly of late, for more public housing. And the participants spoke in detail about the types of housing that they'd been placed in that represented that outdated roof over your head type of scenario that may be protecting them from the elements, but did little else to promote good health, well-being and social inclusion. Participants also spoke about the immense relief that they felt when they finally had accommodation that fitted the definition of a home. The list you see before you now represents these stories. And as a researcher, we boiled them down to the core message that participants were telling us. Within every one of these needs are stories and experiences of this need, either being met or not being met. The next slide shows us another important insight from the longitudinal analysis across the 3 interview time points in relation to service access and engagement that were driven and determined according to a hierarchy of met or unmet needs. For the most part, participants, all of whom had a history of chronic homelessness, prioritised the urgency of their needs in the following order: ensuring survival needs are met before obtaining housing that is safe, secure and appropriate, before attempting to resolve physical, mental health, social inclusion and or relational issues, before building employment and other personal independent goals. It highlights how important it is for services to meet the client where they are at any point in time, to not rush to try to find employment, for example, when other more immediate needs are not managed, stabilised or even resolved. Achievement of these needs is influenced by a range of factors, including the capacity of the service system to provide required levels of care, the time taken for the client and service provider to establish a trusting alliance, and the complexity of issues that need to be overcome at each step. In relation to J2SI participants, many affirmed that the J2SI program was particularly helpful in supporting them to address the first 2 priority areas. So the next slide shows the second goal of the qualitative research, which was to provide the opportunity for those who were part of the J2SI program to give feedback about their experiences. The feedback from participants was extremely positive, namely due to the obtainment of permanent housing, which Paul showed in his statistics, and the way they were supported by case managers to prioritise their particular needs. In fact, the qualitative findings revealed that the J2SI model was seen as being most effective at providing practical support and relational support to clients. And in the next couple of slides, I will share those insights with you. So in relation to practical support, participants spoke in detail about how that practical support made a tangible improvement to their quality of life. They spoke about stories and experiences that revealed J2SI case managers offered timely, streamlined and uncomplicated service access. They worked hard to ensure clients had rapid access to housing. They provided practical support with everyday tasks that are experienced as difficult to navigate or complete. And they spoke in detail about how J2SI workers advocated strongly on behalf of clients. In relation to relational support offered by J2SI case managers, which revealed a strong, trusting relationship was built over time, and that continuity of care was highly valued by clients. Participants spoke about J2SI providing a trustworthy, accountable and authentic service, of having case managers that genuinely cared and did not lose hope, and who allowed for client self-determination in relation to service provision. This quote on the next slide, by a J2SI client reveals how much this client valued being an advocate that having an advocate that stuck by them through their many life changes and the impact that it had on them being able to exit homelessness.
Thanks, Monica. Your report certainly highlights that best metrics to often gauge a program's success is often through the lens of its participants. And this highlights that importance of ongoing client-centred evaluation. Therefore, it's fitting that the last word on this program comes from a J2SI participant, Fred. Fred's a former J2SI participant who can personally talk to and explain how unique the program is and why programs like J2SI are really needed. Without giving anything away, Fred was sleeping rough when he came to our dining hall for a meal, and from that welcome and hospitality came the offer of support. And over time, Fred was offered a spot in the J2SI program. Now, I can see that I've cut across Monica's report. Monica, excuse my mistake. If you would like to come back in and finish your report, please feel free to do so.
Sure. Thank you. That's okay.
It's a long pause and I thought there's my moment. Sorry, people.
No, that's fine. It's absolutely fine. Okay, so I'll just go back to where I was up to, which was that wonderful quote by a J2SI participant. And we're up to the second one, which just revealed how much clients also valued the way J2SI managers celebrated, how much they celebrated working, their J2SI case managers working hard to fast track them out of homelessness and into public housing. And the amount of work that was recognised of going on in the background to ensure that that was happening, including the practicalities of moving into a house and setting up home. So we also asked about, from J2SI participants, how the program could be improved. So we noticed that although the J2SI model was, for the most part, seen as aligning with the needs of people who have a history of chronic homelessness, that the two main issues that clients found challenging about the J2SI program were dealing with case manager changeover and the tapered care approach, where the latter part of the program decreases in intensity in order to prepare clients for independence. So what this highlighted, though, is the importance of the continuity of care model and maintaining that relational aspect of service provision in order for participants to stick with it and to begin working on personal issues that prevent them from living a more independent life. So we developed a set of recommendations, and for this presentation, what I've done is I've divided it up into different stakeholders. And I suppose for government policymakers and even private enterprise, just the importance of increasing permanent housing options, but not only just a roof over your head, but safe, geographically dispersed, accessible, appropriate, dignified and homely options. So there's a big difference between housing and a home, and our participants were telling us the importance of this quite loud and clear. For the service sector, please strengthen community partnerships and integrated service delivery models of care. No one service can do it all. The clients that are seeking support have, as you know, very complex and sometimes very complicated issues, and ensuring that there is access to high quality support within the community is really, really crucial. And for Sacred Heart Mission and the J2SI model of care, the report details a number of recommendations, and you can see a summary of those on your screen. The one I would really like to highlight is to establish a J2SI Consumer Advisory Board made up of people with a history of chronic homelessness. As you can see from this research, their insights and wisdom cannot be underestimated. And finally, the key take-home message is that J2SI is Sacred Heart Mission's bold and commendable attempt to end chronic homelessness in Australia. And the fact that participants felt lucky to have been randomly selected to be supported in this intervention reveals that continuous development and rollout of the J2SI program should also be supported. I will close with a quote by one of the J2SI case managers who shared their wisdom on what is required to end chronic homelessness. Anyone who works in this environment knows that by the time people are sleeping rough, it wasn't a bad week that brought them to that point. There are a whole lot of things that have happened for a long period of time. They're not going to be remedied with a 3-month intervention of 1 hour a week. So my experience has been that relationships is primary. And if that relationship is not one that's credible and trustworthy and real, transformation is not possible. Thank you.
Thanks, Monica. Now that's what you call a nice cue and segue to me, and my apologies for the rude interruption. If we had been in person, I'm sure that natural cue of getting on and off stage would have helped. So forgive a rookie's mistake on her first webinar. So look, an exceptional report there, Monica, and really thank you for bringing to the client to the centre of this program evaluation. So it's time for me to introduce Fred. Now, Fred's a former J2SI participant who came into the program after accessing Sacred Heart Mission services. Now, I won't reveal his story, but it's a story that can be very daunting for anyone to share. And it's a story we don't always get to hear from someone firsthand. So Fred has rightly chosen to give himself an alias, Fred, and not show his face, which we absolutely respect. So with that in mind, Fred, I invite you to share with us your story.
Yeah, thanks very much, Kathy. And Monica, that was a great presentation. Likewise, Paul. Monica, I have to agree actually with pretty much everything you said there. As a user of the J2SI program, which I was very fortunate enough, I think you've really nailed your research well.
Thanks,
So as Kathy said, my name's Fred. It is a pseudonym, and I'll briefly talk about my experience with the Sacred Heart Mission and the J2SI program. And look, I really understand that everyone's story is unique and individual, and this is just my story and my experiences. So just briefly, as a result of various circumstances, I was married, but unfortunately my marriage broke down. I lost my job and ended up being homeless. My ex-wife was supportive of the relationship I had with my children. However, until I had secure accommodation, she would not let me physically have them, and I could only visit them at their home. I was living rough and couch surfing until I was able to obtain accommodation in a rooming house in Fitzroy Street in St Kilda, which was pretty difficult to live in. The bathroom and kitchen were shared facilities, and I would always make sure that whenever I left my room to either use those facilities, I would lock my door. If I went to the toilet, I'd always ensure I wore thongs or shoes. And if ever I used the kitchen, I'd always stay there whilst I was cooking, and I never took any of my children to the rooming house at all. That was because of their mother's wishes, and also I just didn't feel that it was a safe environment for them. I did attend Sacred Heart Mission for breakfast and lunch frequently, and I've got to say that the food was always good, healthy and plentiful, and the staff were always friendly, happy, non-judgmental, approachable and supportive. A Sacred Heart staff member actually approached me about the upcoming J2SI program at the end of December, start of January 2016. I applied and was extremely grateful that I actually got accepted into the program. My case manager worked with me and explained that it's not just a one meeting and only for 1 meeting a week for 3 months. It's actually a long-term program that goes for 3 years. Initially, I was a bit tentative, and I suppose just over time they built my trust and my confidence with their ability to actually put my needs and desires and wants at the forefront of our I suppose, working together. I was very fortunate that not long after that I was actually got some transitional housing, which actually enabled me to have my daughter stay with me. Part of the, I suppose, requirements of getting that transitional housing was actually getting my wife or ex-wife to say that I would be able to have my daughter stay there. And she was, I suppose, graceful enough to do that. And I would not have been able to get that housing or that transitional housing without the support and that advocacy of my case manager and the J2SI program. One of the things I also did was I looked through my application that I had put in many places, including Department of Health and Housing Services for commission housing, and actually noticed that I had completed the forms incorrectly. So it was pretty good that they actually helped me correct my mistakes on that form to include the correct information. And one of the parts on that was ticking the community housing options, which is now there. So I would suggest anybody that has an application in, update your application, particularly if any circumstances change, like having children or different children, relationships, and be proactive and contact the numerous community service departments directly. I was fortunate enough, after being in transitional housing for nearly 2 years, to actually then get permanent housing. And again, that was only through the partnership that Sacred Heart had with community housing at the time. And if it wasn't for them and the advocacy for me, I'd probably still be in the transitional housing. I know when I was trying to get housing myself, it was just very difficult, and quite often it felt like I wasn't listened to. Where with the support and advocacy of the case manager at J2SI, that it was like a different story altogether. I suppose to finish up, I'd just like to thank, or send a huge thank you to all the Sacred Heart Mission, all their staff and volunteers. Personally, the support, encouragement, guidance, hope, and I suppose the reinstalled self-confidence that I received during my time in my 3 years at the J2SI program was invaluable. I truly believe that this program is vital to continue and support people, and I think everybody should sort of get behind it, and if it can go nationally, it'll be amazing. One of the biggest differences for me, actually having secure housing, particularly during this pandemic, is that peace of mind. It's a big difference adjusting from living on the street or living rough, couch surfing, to actually having your own home. And I think you made that point, Monica, about a house and a home. It actually took me a little bit of time to adjust to that as well. But yeah, I'm in a really good space at the moment. And I don't think I would be in this space without the support that I got through being on this program. So thank you. I'd just like to hand it back to Kathy.
Thanks once again, Fred. Your courage in sharing your journey with us today is, you know, significant. I think you really need to acknowledge the you've come a long way and been on such a great journey. And I'm really thrilled that the support that J2SI has provided you has been life-changing. You know, that for us is the biggest thank you. So everyone, that's it for the formal speeches. So I'm going to hand back now to our host, Rhonda, who's going to facilitate a Q&A. So hopefully you've been putting your questions up in the chat box. Over to you, Rhonda.
Hi, everyone. Thank you so much. And I apologise for those technical issues at the beginning. We've done 38 of these webinars now, and that's actually the first time that's happened. So I'm not sure what has happened today, but I apologise for that. I want to thank all of the presenters. It was a very interesting series of presentations. And now we're going to get to the Q&A. So we've turned off the screen sharing and we're now on gallery view. It's really nice to see everyone. So we've had a few questions come through, and I invite you to ask questions if you like in the chat feed. So this will run for about 20 minutes, 30 minutes. Feel free to ask whatever you like in that chat feed, and we'll go through them all. We'll get to as many as we can. So the first one is for Kathy. Kathy, I think you'll like this one. If you had a magic wand, what would you do with J2SI?
Well, I guess from our perspective, J2SI is a proven model to address chronic homelessness. So what I'd like to see is right across Australia where chronic homelessness exists, that the J2SI model can be replicated. And look, we believe that you know, a payment by results contract is really beneficial to the program because it keeps, you know, the service provider accountable to delivering outcomes. So I think, you know, my magic wand would be to roll it out nationally, but to also do it through an outcomes-based contract that makes the system accountable for delivering impact.
Great, thank you very much. We've had a lot of interest in Fred, and a lot of people thanking you, Fred, for your participation and for sharing your story. So Julianne specifically asks of you, and she says, thanks so much for sharing. Fred, now that you have stable housing, can she ask what you're hoping to achieve next?
Yeah, thanks, Monica, and thanks. Sorry, who was the question from? I missed that.
From Julianne.
Oh, hi, Julianne. Yeah, Julianne, just to let you know, I've actually gone back to studying. So I'm finishing my degree. I finished my degree. This is my last semester, and it's been life-changing. So as I said, to have that security and safety of having my own home, the adjustment took a little bit of time to get used to, as I mentioned earlier. But then once I did that, I reevaluated, I suppose, what I was doing with my life. And it was through the support of my caseworkers and the J2SI program that, as I mentioned, they I suppose, instilled my own self-confidence and belief that I could undertake further studies. I hadn't been to school for many, many, many years. And I suppose they gave me hope. And having that hope to actually try something different and do something different. And I think initially I was surviving, now I'm thriving. So yeah, it's wonderful. I hope that answers your question.
Yeah, it's a great answer. It's really lovely to hear that. I'd encourage you, Fred, to turn on the chat function if you haven't already, because there's a few comments there for you, which are lovely. One from Jane, which says, "That is so cool, Fred, have fun." So another question for Kathy. This is from Russ. How is the development of the ELC licensing model going, and what's your biggest challenge at the moment in that regard?
Thanks, Russ. Good question. Well, we've been making endeavours into Western Australia and into the Northern Territory. We've been engaging with governments over there around their interest in social impact investment and the J2SI model specifically. And it's still work in progress. I must say COVID's got in the way. So unfortunately, it's kind of paused where we're at. And, you know, hopefully when things settle, we can progress that further. But certainly we've got very interested partner providers across Australia and interested state governments, as well as the Commonwealth Government. And the Victorian Government have been terrific ambassadors for the program. So if anyone's on the webinar from other states and territories, our Department of Human Services or Treasury is more than happy to talk about the J2SI program and what results we've been getting in Victoria.
Excellent, thanks, Kathy. Paul, this is a question for you. To what extent are the results materially significant to the extent that they will help Sacred Heart Mission make the case for investment in other jurisdictions? Oh, you need to unmute yourself there, Paul.
Yeah. So thanks, Rhonda. And I'd also like to thank Fred for those comments. I think that was really insightful. So that was really useful. And as I can see people on the screen, just say thanks to not only all the participants in the study, but interviewers. I can see Susanna there. Thank you, Susanna, for all of that work over 3 years interviewing, and others in the research team as well, Catherine, Zoe and Jessica, I can see. So the results here are very important across a range of different areas. And whilst you could see the significant outcomes in terms of cost offsets, as they're called, you know, that the program achieves better outcomes, primarily, I think, through providing stability in terms of housing and providing a home that feeds through in terms of lower costs in a range of different areas. So there was those kinds of results, which are very important for governments and other funders in terms of their desire to take on the program. But I would probably say, sorry, that we really do need to look at things more holistically beyond those kinds of dollars, which I think have probably been given too much prominence. So cost savings are really significant, but I would like to see a broader set of outcomes being considered when we're looking at an outcomes-based program, and that's something that I think is really important. So whilst governments can look at those kinds of dollar savings and say, wow, you know, these programs pay for themselves and more, as we showed in this. There's also really interesting results across the board, and to bring out those kinds of stories that Monica brought out are really critical. So when you're looking at these kinds of programs, even in an outcomes-based system, in terms of payment, look across the board. And when we do look at the cost savings, as we've shown here, recognize that the distribution matters as well as the means. So, I mean, that's a technical point, but this program was interesting in that we saw outcomes in areas such as mental health and drug and alcohol areas that we probably haven't necessarily always seen in other kinds of programs. So I would like a more holistic approach. I know that's more complicated than simple dollar numbers, but I do prefer that kind of approach.
Okay, thank you, Paul. Monica, a question for you from Hannah. After entering long-term housing, did any of the participants seek or wish to relocate for social reasons? How does the model respond?
Thanks, Hannah. I don't have any, I suppose, specific or a specific answer around, you know, a participant that has entered housing and then wants to relocate. But I suppose what I can say to that is that having the housing allows people to settle and to start to settle and to begin addressing their other needs. So if you have a look at that hierarchy, that triangle that I showed you, the qualitative data revealed, you know, we had 46 hours of interviews with people that were involved in the J2SI program or in services as usual. And what we really heard in that was that it was, you know, that the importance of that housing first model, that first we need to survive, we need to eat. It's that, you know, hierarchy of needs type thing. Then we need to just settle in a home, and that home needs to be warm. Things need to work. It needs to have enough bedrooms. We need to be able to have, you know, social relations, all that sort of definitions. It needs to match what we would consider vital to fulfill our human rights, I suppose. And what we heard was that in many, many, many cases, those things weren't happening. But it was once there was that goal achieved of just having a home, that's when other needs in their life, whether that be mental health needs or, you know, reducing substance dependence issues or reconnecting with family, with children, trying out, you know, things that they've always wanted to do. For example, just, you know, basic things like hobbies and work, like Fred, you know, study like Fred has been telling us about, which is great. That's when, you know, those things can happen. So it's really important to note as well that to not have these houses or these homes just centred around cities as well. So a lot of our participants too, although this is a Melbourne-centric project, came from all areas of Victoria and sometimes Australia as well. And the importance of having a home in a place that actually is their home, that's familiar to them, that has the services that they're connected to, and family and friends. And so to actually have geographically dispersed housing around Australia is really, really important. So Melbourne's a very sprawled out city. Though that public housing needs to be provided across the city, from the outer west to the outer east, north, south, everywhere, not just concentrated around the city as well. And that came out pretty loud and clear in the qualitative findings as well.
Can I just add to that with, we did see some transitions in terms of actual places within the same tenure, actually, in some cases. But one of the important things that lies behind the model is a very broad set of partnership agreements with housing providers. So you can see the public housing results, but there's also significant community housing results here. And but by having a broad set of secure MOUs with housing providers, you're actually then able to offer up greater choice. So rather than just going down one or two channels, which reduces your probability of getting people into housing anyway, but by having a broader set of partnership agreements, in other words, taking a more systems approach to this, you give the opportunity for participants to have greater choice in terms of the places they go to. So some people want to have, and in many cases need, a kind of common ground kind of setup. Others want far more scattered site kind of options. And then if you have more housing agreements, you've got more options to go to. So I think that's an important thing to remember.
Thank you, Paul and Monica. We're getting a lot more questions now, which is fantastic. But one that came earlier while you were all presenting was from Rachel. And Kathy, I might direct this one to you. Her comment first was, such a great program. I truly hope it expands across Australia. The question is, the issue of affordable housing, lack of, is obviously a significant issue. How did the program work around this when people, even on the most urgent public housing waiting lists, can wait for months, if not years, especially large families? And for these individuals and families, private rental is just not an option.
So the way in which Phase Two managed this in a really constrained affordable housing supply environment was two ways. And one was what Paul mentioned about the partnership with community housing providers. So we made sure that we weren't just relying on one source of housing supply. For public housing, people were eligible under the priority housing list. So that meant that they were one of the priority groups eligible for rapid access into public housing, but also our partnership with community housing providers. And I think what that enabled community housing providers to take a kind of risk on our tenancies, because there was 3 years of guaranteed support to help people sustain their housing. So where there might have been a reluctance to kind of house people who are experiencing chronic homelessness, the model kind of tipped that on the head, because we were there for the full 3 years, and it meant that we could help people to, manage and sustain their tenancy over time. We did get a small amount of people into private rental, but that was pretty limited, where the majority were either in public or community housing. With Phase 3, we're taking an approach of having head leasing supply in the lieu of public housing and community housing being constrained during the 5 years of Phase 3. We kind of navigate the risks in that environment where housing supply is challenged.
Thanks, Kathy. I'm not sure who this one will be for, so I'm just going to ask a question and you can jump in. From Chris, could you compare and contrast the J2SI approach with those used by other leading service providers for people experiencing homelessness? And were the people in the comparison group being supported by other agencies?
Yeah, just on that last point, no one entered the research study unless they were already connected to a service. So entry was via services. So all were in, if you like, the service system, receiving some kind of support prior to entry. And there was no attempt, obviously, to restrict any kind of support. So with all the options that were coming up in Melbourne, those in the comparison group were picking up all sorts of different kinds of support beyond what they might have had right at the beginning as well. So support was being offered to all of those in the comparison group as per normal. So there was no restriction there. What was the first part of that question? It was
the first part of it.
How different? Yeah.
Yes.
So
compared to other leading service providers.
Yeah. So the issue of, I suppose, that Monica mentioned, the intensity of support was definitely the broad range of supports, the duration of support. So often you're restricted in terms of resources to a short duration, limited number of services that you're providing, and you're reliant entirely on referrals. So by spending more, you can see that it is a bigger spend. This is a bigger spend. By spending more for longer across more services, direct service delivery, you've got something going. But I think just to re-emphasize this point about partnerships, that and anyone can do this kind of thing, of course, and you do need money to do it, but having the structured, systematic kind of approach or systems approach to housing providers, I think, is a really big thing. That would be one of the things that I would be definitely looking at. So, to be able to get people housed fairly rapidly without guaranteed housing is a really significant part of this.
Excuse me, can I just add to that? That's Fred here. One of the biggest differences for me was I actually felt my case manager really cared and was genuinely interested in helping me. I'm not saying that other service providers that I've used didn't care, but it was almost like they were overloaded with their caseload and they didn't have the time, and you were limited to, I think it was a maximum of 3 months with virtually a 1 hour meeting a week if you were lucky. And not to say that they were just ticking the boxes, but I think they didn't have the time to actually be able to put that intensive care and support that actually was required or is required. And to know that you've got that ongoing support all the time, or for that 3 years, is just really, I'm trying to think of the right word, just really, I suppose, refreshing and helps get through a lot of those anxieties and helps support to, as I say, knowing that you've got somebody in your corner and who can advocate and has the contacts and knows how to do that and knows how the system works, if you like. Because just being a normal person, so to speak, it can be quite challenging to even get your foot in the door to look at housing. So I think without that support, it wouldn't have been. I doubt that I'll be in the position I'm in now. I also just wanted to add, I was living in the inner city, and with my permanent housing, I was fortunate enough and I actually chose to come into the outer suburbs, and that was just so I could be closer to my children. But that transition of moving from the inner city where I had all my support networks out to a distance away from that actually was quite challenging at the start. And it took a fair bit of adjustment on my part to get used to living in a different area and not having everything just where I knew everything was, and being away and trying to, I suppose, get used to living in a completely different area. So that was also a challenge. So I think even though there may be housing available everywhere, just also, I suppose, be mindful that it may not actually work for people if you're moving from where they're currently living to another area, unless they feel comfortable and actually want that. But that's just my own view.
Thank you, Fred. I have some other questions here related around the support that we've just been talking about. So Carol asks, she's interested to know what happens after the 3 years if someone needs ongoing support, and will there be a follow-up evaluation of 4 or 5 years? Who would like to answer that one?
I'd love to do a follow-up evaluation. Yeah, I'll let Kathy answer the other questions. But by the way, there is a 4th year ongoing piece of work in terms of this program that is actually funded by DHHS in terms of a survey in the 4th year, and there's continuing administrative data linkage. So we are picking up interesting kind of data on the interaction between homelessness and COVID-19 during this year as well. So Susanna's currently out there at the moment doing, well, she's on the screen actually, so she's not doing an interview right now, but she would be doing interviews. But Kathy can answer the other part of that.
Yeah, so the control group of Phase 2 is actually our, what we call a counterfactual for the social impact bond. So that means whatever happens between the control group of Phase 2 is the measure for the impact of our Phase 3. And that is one of the reasons why we're doing a 4th year, because we kind of need to understand what happens as a result of the intervention post the service response, if that makes sense. So that'll be probably the last survey we do of Phase 2 participants. But, you know, if there's anyone who wants to fund a further evaluation, because Paul will tell you surveying participants and the time and energy that it takes to actually follow up with people, because as you can appreciate over time, people are less wanting to connect back into a research study. So it is very difficult, and you'll see it from Paul's report when you receive it. Keeping people engaged in a longitudinal study is very challenging and difficult. So, you know, if there was more funding available, we would certainly look at that opportunity. But at this stage, we've got the 4th year study because that's connected to our social impact investment. Rhonda, did that answer the question in full, or have I missed a bit of it?
I think, yeah, that did answer the question. Thank you very much. Was swapping around a little bit here, but the very interesting questions. Thank you to everyone who's asking them. I'm not sure of the person's name, but they've asked, interesting hearing Fred's story regarding the relationship with his children. Does any of the evaluation data capture positive impact of housing on relationships with children and thus improved outcomes for children over the long term? Oh, it's from Marguerite. Sorry, she put a name at the end. Who'd like to answer that one? Maybe Monica?
Thanks, Marguerite. We've definitely got data on the impact of housing on children. We couldn't include everything in this report, but we're hoping to do some more data analysis over the next year and start producing some papers around, you know, the impacts that housing does have on those important relationships in people's lives. But definitely I can say that, you know, particularly having a home, we had one person in our qualitative study who was repeatedly offered housing that didn't have enough rooms to allow her teenage daughter to live with her. So we really, and then when, you know, the accommodation was provided that did give her that space, then that relationship did improve. So you know, it sort of boils down to common sense as well, you know, that we need to have, you know, a home in order to have those, you know, family relationships. So, you know, it obviously does have an impact, but we do now have a lot of evidence to support that. So I really look forward to presenting those other papers in the future.
Fantastic, thank you. From Kira, maybe one for you, Kathy. Was the program a voluntary program? How did you manage any client non-engagement or lack of engagement, especially when the client was most in need?
Yeah, look, I think engagement in the program is really important. So it is a voluntary program. No one is forced to participate in J2SI. So that first 3 months from referral is really critical. And we start by working with the referring agency. So what we want to do is be clear about what the eligibility criteria is. We want people, I mean, ideally if people are engaged in some level of, you know, crisis or case management support, that the referring agency has kind of developed enough rapport with them to assess that the J2SI program would be beneficial for them. And then they help navigate that referral into the program. And then it can take at least, you know, 3 months for the J2SI worker to engage with the participant. Now in that time, people might opt out and might go, I don't want a worker hanging around for 3 years. no thank you, not interested. You might have people who are just way too chaotic for various reasons and are unable to engage, and we kind of need to call it at a point in which we can't kind of connect and create that engagement. So that was why in the randomised control trial study, you actually find that we actually had more than 60 people recruited into the program and more than 60 recruited into the control group, because you had that attrition, and particularly that attrition at the beginning where people aren't necessarily engaging in the support. So that was really important. And the same when we've delivered phase 3. There's a bit more stricter controls about that, the way in which we manage the social impact investment, but we absolutely have kind of a wait list where if people don't engage in the program, there are others who will step in to engage with the support services.
A follow-up question, is it possible for the comparison group to now receive the same supports as the intervention group received during the study?
Absolutely. Now that might mess up our 4th year study, but people will not be denied any services. So we've been very clear about that when we were negotiating the social impact investment, that as a result of the J2SI intervention, and particularly we're in our final, well, what we call the 3rd cohort of the phase 3. So certainly people who've received J2SI Phase 2, or sorry, who didn't receive J2SI Phase 2, would be eligible to come into the program. So we're about to kind of commence the referral process because we're now in the 1st week of August. So, we know there's lots of people who are residing in hotels who've experienced chronic homelessness. So we're super keen to get out there to get those referrals happening and start that pathway into housing for our homeless Victorians.
Okay.
I sound like a politician when I said that, sorry.
No, it sounded great. This question's from Irene via Nicole. Does J2SI have a plan, or Sacred Heart Mission have a plan to respond to the recommendation to establish a consumer advisory board?
Yeah, look, I think it's an interesting concept, and it's one I think that most organisations are challenged with around consumer representative boards. And we've certainly over the years attempted kind of having a consumer rep group and had challenges with it, and we are reviewing our kind of consumer participation mechanisms right across the mission. So I think we'll certainly take on board Monica's recommendations and see how we can integrate them right across the mission, but also into the thinking around our J2SI program. So we need to kind of work out how it'll fit and how it'll work, but we're certainly open to those mechanisms.
One last question from Rachel, just came in. Will it be possible to refer clients to the next program? And if so, how?
Absolutely. So we are encouraging referrals through our main referral partners. So, there'll be organisations such as Vincent Care, such as Launch Housing, such as the Salvation Army and our own Sacred Heart Mission services. So those organisations through their teams have all been briefed about the referral process, and we'll start to see those referrals come in as the 1st week of August has begun.
Wonderful, thank you. We're just about at time. A lot of people have been making some lovely comments in the chat feed and thanking all of the presenters and all of the people who've worked so hard on this research program. So I'll pass it on to you, presenters, and lots of lovely comments for you too, Fred. I'd encourage you to read them. I'll send this file to you. Other people have asked when the reports will be available. They will be available from tomorrow. So CSI, on behalf of Sacred Heart Mission, will send the recording of this webinar along with the slides and also that video that we missed, like the visual of it, not the audio, and the reports as well, importantly. So we'll be in touch tomorrow, and everyone's saying thank you. So again in the chat feed. So thanks again to our presenters, and thanks to all of our attendees as well. And we look forward to talking to you soon. Thank you so much. See you later. Bye-bye.